Paramedics urgently racing to save a baby in crisis.
Wireless location of an emergency.
He's not breathing. He's not breathing. He's not breathing.
He is on the floor as a sheriff's deputy gently performs child CPR, his thumbs delicately pressing on the infant's chest.
Your compression is just like that.
He turns the baby over and taps on his back. You can hear mom crying. Then this, suddenly a moment of utter relief. Little Laker is gurgling and starting to cry. Medics put an external defibrillator on the baby that helps reestablish the heart's rhythm.
Hey everybody, welcome back to Firehouse Heavyweights TV, where I teach parents how to keep themselves and their families safe from car wrecks, from fires, and medical emergencies. I'm your host, King Jerome, and today I want to talk about a pretty scary topic that can happen to a lot of new parents and young parents, and that is breathing problems with their newborns and small children. I want to give you a disclaimer. I am a practicing paramedic, and these views and topics that I'm talking about here are things that I look at and that I'm looking for whenever someone calls 911 and I go to their house with my crew. These are the signs and symptoms I'm looking for, because these things will dictate in my mind priority of how medically aggressive I'm going to treat the patient. Things ranging from just giving them some simple oxygen to the most severe of doing a surgical cricothyrotomy, which is pretty much an emergency tracheostomy. All right, so let's start with understanding what respiratory distress is. Pretty much respiratory distress is when the body is not able to use the oxygen that is coming in efficiently. Some sternal retractions. You can see their neck, how it's flexing, the use of accessory muscles. The thing with kids versus adults is children and newborns are respiratory driven. What does that mean, King? If you have an adult and say they hold their breath or they can't breathe, for a long periods of time, yeah, it's going to be issues, but it's not going to lead to cardiac arrest. For children, it will. If a child's respiratory system or respiratory drive is compromised, I can promise you respiratory distress will lead to respiratory arrest, which respiratory arrest is like cardiac arrest, the heart stops pumping, and respiratory arrest, the lungs stop doing their job. So that for children will lead into cardiac arrest. So my goal with this video is to show you guys the things I look for whenever I go to these calls. Some common causes of respiratory distress in children. You have things like asthma, things like RSV, croup, bronchiolitis, which is an advancement of RSV. And these are especially important to look out for with the winter months around the corner. And this is when we see a very big uptick in a lot of calls to go pick up kids or see patients with a lot of breathing problems. So let's talk real quickly about each of these. The asthma, your airways and your lungs, they narrow down, making it very difficult to get air in, right? So in the ambulance, we have cardiac monitors, and these monitors are able to tell us the way you're breathing. It will tell us if you're currently having an asthma attack and if you are about to have an asthma attack. We monitor your CO2, your carbon dioxide, and monitoring that will show us what's going on. Common one, like I mentioned before, is bronchiolitis or RSV, and this especially happens in the winter months, spread through droplets. A lot of times kids come from school or daycare with this already, and pretty much what it does, increases mucus production. They're going to have a lot of mucus, runny nose, fever. They'll have some wheezing, coughing, and it's always great to check this out, to get it checked out. One thing I always suggest to new parents as well is make sure you always keep your baby's nose and mouth clear from boogers as best as you can. It's not the easiest, but keep it as clear as you possibly can all the time, because like I mentioned before, kids are respiratory driven. You have croup cough. Croup. You guys never heard of croup cough? It's a seal-like barking sound when kids cough. And I'm gonna play a little audio right here, what that kind of sounds like. Croup can be caused by the parainfluenza virus. It can be caused by RSV. You can have a fever, or your children can have a fever from it. And pretty much what it is, it's like an inflammation of the vocal cords. So it can cause what we call inspiratory stridor. So it's like a really kind of horrific sounding whistle when they breathe. I wouldn't risk it. I would call 911 if you see your child is having a difficult time breathing. With epiglottitis, cartilage or skin that covers your trachea or your windpipe whenever you swallow. That way you don't get food and liquids down your lungs. So it covers it whenever you swallow. That can swell up, and the tissue around it can swell up. So what happens with this is that the child will have difficulty breathing, some difficulty swallowing. It hurts when they do that. When they try to talk, they sound like they got hot food in the mouth, like I can't, like that. Like they can't really talk because it hurts too much. They can have a fever, and the problem with this can be a life-threatening situation just because it is so easy to lose that airway. Because if we try to put anything in their mouth, they're already anxious to begin with. You know, small children, they'll be anxious to begin with. So anything can cause it to completely close up. Some signs that you would see with this is your child could be lethargic. They'll have a fever. They'll be drooling a lot. And that's like the biggest hallmark sign of epiglottitis compared to all these other common respiratory and breathing problem things that happen to kids. With epiglottitis, the hallmark sign is a lot of drooling. Some ways we treat an EMS is with humidified oxygen and some corticosteroids like Decadron, but we don't want to agitate the child. So if your child has epiglottitis and you notice all the drooling and stuff, get them to the hospital as fast as you can, or call 911. Next on the list is pneumonia. Pneumonia is pretty much a lung infection. Pneumonia could sound like have a gunk in their lungs. So one lung and pneumonia is affected, and pretty much the infection causes buildup of junky gunk in the lungs that's causing them to have that difficulty breathing in their lower airways. Some symptoms you'll see with this is also a fever and difficulty breathing. Next on the list is any kind of obstruction like choking. Children and infants are notorious for choking on stuff. Even though that's not the goal of this video to cover that, if you are not able to get something that a child is choking on with back blows and a little bit of chest thrust, and I'm going to show you a video right here of what I mean.
Giving back blows creates a strong vibration and pressure in the airway, which is often enough to dislodge the blockage in the baby who is choking.
Call 911 right away. Just call 911. Because what we do in EMS, if someone starts choking and we are not able to get whatever is stuck out of there immediately, we immediately start doing chest compressions. Why would you do chest compressions? It can build enough pressure to dislodge whatever's stuck. And two, since they're not breathing, they still need all of that oxygen to circulate around. Now, what I want to arm you guys with is the knowledge of when you should call 911, because I know a lot of parents that I encounter are very reluctant to call 911 because they feel like they're a bother or that it's not a big deal, things like that. I want to assure you that's not the case. Now, these are the signs that if you see any of these or a combination of these, you need to call 911 yesterday. Seesaw breathing. Seesaw breathing is when you're seeing the upper chest and the lower abdomen almost moving in a seesaw motion while they're trying to breathe really fast. Sternal retractions. I'm going to clip a little quick video here too of sternal retractions. What that looks like is when they're breathing and you can see their ribs, you can see their neck, you can see all these muscles being flexed as they're trying to breathe. You can see that with, especially with older patients with a lot of difficulty breathing, like some COPD, emphysema, things like that. How hard they're trying to take a breath in, that it's recruiting all these muscles to help them breathe. Tripoding. So tripoding, if you guys see how I'm sitting forward right here, if I'm over here trying to breathe like this, leaning forward, is what we call tripoding. And that way, that's the body's way of trying to get as much oxygen as possible. When we come into a house to go assist a pediatric patient, our assessment doesn't start as soon as we're in front of the patient. It's as soon as we step into the environment. If I'm there for a child, I'm looking, as I'm coming in, I'm observing the child to see if he's tracking me, to see if he looks sleepy, if he's awake, things like that. Sleepiness and head bobbing. If your child is really sleepy from trying to breathe, his head is bobbing, can't keep it up, and it seems like they're giving up in breathing, that's a problem. That's a big problem, because that's respiratory distress starting to go towards respiratory arrest. The next one, and this is especially common with newborns, is grunting. Grunting is not really breathing. It's what we call, in cardiac arrest, even for adults, agonal gasp or breathing. They're not breathing, they're just gasping, but it's not even real breathing that they're doing. So grunting is a very big problem and a big red flag. Let's say you do end up in a situation. What do? Another sign to look for, especially with your newborns, is cyanosis. And that's pretty much bluing or graying of their lips, sometimes their nose. If you guys remember, and this doesn't happen with every newborn, but when your baby was born, you might have noticed his or her fingertips were a little grayish, a little bluish. It doesn't happen all the time, but it happens to a good amount. That is what cyanosis looks like, and that resolves within 5 to 10 minutes of the baby being born. But when you notice this on your baby and he's breathing, and this happens in adults as well, and you start seeing that discoloration around the lips, sometimes it can happen in their chest and their stomach, you need to call 911. Call 911. If you have any doubts whatsoever, if your child is having some kind of difficulty breathing, but it doesn't seem to have any of these symptoms that I mentioned here, but it's concerning to you, do not hesitate to call 911. Call 911, because the thing with kids, their bodies are able to compensate extremely well. So with adults, when their health is starting to deteriorate and they're about to go hit cardiac arrest and stuff, it's kind of like a predictable slope, like, oh, they're progressively getting a lot worse, where you're expecting it to get to the worst possible place. With children, it's up here the entire time. They seem completely normal, and then boom, they tank, like really, really fast. And this is why I'm telling you that it may seem like it's not a big deal with some of these. Even if your child is doing something, some breathing that is kind of concerning to you, but you're not really sure whether you should call 911 or not, or you might want to go to an outpatient clinic or something like that, do not hesitate to call 911. Know that being informed and prepared can be all the difference to your child. So I hope you guys enjoyed this video. Make sure you like, subscribe, and hit the notification bell so you guys are informed every time of when I upload a new video. And the next thing I want to talk about febrile seizures. We can see that in this video right here.